Hello everyone. So previous class we discussed about the basics of strengthening, what is muscle performance, what are the elements of muscle performance, that is strength, power and endurance. We have uh, understood briefly about the strength, power and endurance. We also discussed about the determinants of strengthening. Those were alignment, stabilization, intensity, frequency, volume, rest intervals, etc. We also learned about different types of resistance that can be used, which were mechanical resistance, manual resistance, or gravity, body weight of the patient against lifting against the gravity. So here we will be discussing about the principles of resistance exercises. So number one principle is called as overload principle. So what do you understand by overload principle? If muscle performance is to improve, a load that exceeds the metabolic capacity of the muscle must be applied. That is, the muscle must be challenged to perform at a level greater than that to which it is accustomed. So, this means if you want a muscle performance to improve, you have to load the muscle which exceeds the metabolic capacity. So to understand this easily, we will take example other than strengthening. That is, for example, a student gets admission to first year. So in first year, the student will be loaded with physiology, anatomy, and biochemistry. Now, if the person reaches second year, if he or she has to continue the same subjects, then there won't be any improvement in the knowledge. So therefore, in second year, the student will be loaded with extra load, that is microbiology, pathology and pharmacology. And it will be progressed to third year with more loads of rheumatology, clinical, ortho, neuromedicines, etc. So therefore, similarly in strengthening exercises, we have to load progressively to have an improvement in muscle performance or to increase the strength of the muscle. So overload principle is the base for progressive resistance exercises. According to the name, you can see progressive resistance exercises. The resistance will be progressed. So under progressive resistance exercises, we need to understand first what is one repetition maximum, also called as 1 RM. One repetition maximum means the greatest amount of weight a subject can move through the available range of motion just for one time, that is one repetition. One repetition maximum weight. A patient or the subject cannot perform second repetition with that weight. It will be too much for the person to repeat second time. So therefore that weight will be considered as one repetition maximum weight. For example, here in the picture, the subject is trying to extend the knee and extend the hip joint against the weight that is applied on the quadriceps and the gluteus. If the person is able to extend the hip and knee to the available full range against this weight only for one time, then this will be considered as one repetition maximum weight. Similarly, 10 repetition maximum means the amount of weight that could be lifted and lowered 10 times through the available range of motion. So the weight that can be repeated 10 times. According to this picture, the hip and knee can be extended against this weight 10 times. That is called as 10 repetition maximum. So now if we have understood what is 10 repetition maximum, then we'll move on to know what are the regimes under progressive resistance exercises. So basically there are three regimes under progressive resistance exercises, that is called as Delorme regime, Oxford regime and Mcqueen regime. These regimes give us the picture of the protocol, which consists of intensity, frequency, and volume. That is the amount of load that has to be used during progressive resistance exercises, the number of sets or the repetitions that has to be used, and the number of sessions per week or frequency that has to be used during progressive resistance exercises. So let us learn one by one. What does Delorme regime tell? According to Delorme regime, we have to first determine the 10 repetition maximum for every individual subjects or the patient. So 10 repetition maximum is not same for everyone, so it will differ. After we have determined the 10 repetition maximum, we will give the patient 3 sets of exercises with 10 repetitions. The first set will consist of 10 repetitions of 50% of the 10 repetition maximum load. Suppose if we found out that the quadriceps muscle can extend against the load 10 times and that load is 20 kg, then that is considered as 10 repetition maximum load. So here, for example, 20 kg is the 10 repetition maximum load for this particular individual, for example. So in first set, the patient will contract the quadriceps 10 times using only 50% of the 10 repetition maximum load. That is, 50% of 20 kg will be 10 kg. In second set, the patient will be using 75% of the 10 repetition maximum load. That is 75% of 20 kg. That would be 15 kg. And in third set, the patient will be repeating 10 times the exercise with 100% of the 10 repetition maximum load, that is 20 kg. I hope you understood this explanation. Again, I would like to repeat here. Delorme regime explains that first we have to determine the 10 repetition maximum for a particular muscle. We are taking an example of quadriceps. If quadricep muscle overcomes 20 kg for 10 times, that is, if quadriceps muscle is able to extend the knee against 20 kg for 10 times, then that is considered as 10 repetition maximum. So in first set, we will be using only 50% of that 10 repetition maximum, that would be 10 kg. In second set, we would be using only 75% of that 10 repetition maximum, that would be 15 kg. And in third set, we would be using 100% of the 10 repetition maximum, that would be 20 kg. So in all these three sets, patient has to perform 10 repetitions of the movement. That is, if we are taking quadriceps, then patient has to extend the knee against the load 10 times to full range of motion. Next regime is called as Oxford regime, and it is just opposite to Delorme regime. For example, we took here 20 kg for quadriceps. So therefore, first set patient will be performing 10 repetition maximum with 100% of the load, that is 20 kg. In second set, patient will be performing exercises with 75% of the 10 repetition maximum, that is 15 kg. And in third set, only with 50% of 10 repetition maximum, that is 10 kg. So these were two regimes, that is Delorme regime and Oxford regime, which are very important regimes under progressive resistance exercises. For Delorme regime, the frequency of exercises weekly prescribed is 4 sessions per week. For Oxford regime, the frequency of exercises per week is 5 times. Next, let's move on to Mcqueen regime. In Mcqueen regime, it is simple. Here we ask the patient to perform exercises in 3 sets. We give 3 sets of exercises or 4 sets of exercises with 10 repetition against 100% of 10 repetition maximum load. For example, if quadriceps can extend the knee against 20 kg for 10 times, then the 10 repetition maximum load is 20 kg. In Mcqueen regime, for all the sets, 100% of that 10 repetition maximum will be used, that would be 20 kg. And the frequency of exercises per week is 3 sessions, and the 10 repetition maximum can be progressed every 1 to 2 weeks. So these were three important regimes under progressive resistance exercises. Now let's move on to another principle, that is said principle or specific adaptation to imposed demands. So what does this principle mean? The said principle helps therapists determine the exercise prescription and which parameters of exercises should be selected to create specific training effects that best meet specific functional needs and goals. For example, if our outcome or the target is to increase muscle mass, then we would be loading the muscle with more intensity or more weights. So that is specific. And other example, if our target is to increase the endurance of the muscle, we would not be concentrating on the intensity, increasing the intensity. We would be concentrating on increasing the frequency or increasing the volume, that is, increasing the sets or repetitions of the movement or exercise. The third principle is called as reversibility principle. So, what does this reversibility principle mean? Reversibility principle means the increased strength or endurance in response to a resistance exercise program are transient unless training induced improvements are regularly used. So it is basically like use it or lose it. If you don't use the muscle, you lose the muscle. If the muscle is not trained regularly, its strength will be reduced. If the muscle is trained regularly, its muscle will be maintained or increased depending upon the load applied to the muscle. But if the muscle is not used, then it will reverse back to its normal size, or it can be reduced even further below the normal size. For example, in disuse atrophy or prolonged bedridden patients. So these three were the important principles of resistance training. Number one was overload principle, under which we discussed about the progressive resistance exercises, under which there were important points we discussed, which were one repetition maximum, 10 repetition maximum, and the regimes. So there were three regimes, which were Delorme regime, Oxford regime, and Mcqueen regime. The second principle was SAID principle, specific adaptation to functional demands, where we have to concentrate on the target or the outcome and train the patient accordingly. And the third principle is called as reversibility principle, where if we have trained the muscle to grow for 3 months and your muscle size grew from 10 centimeter to 15 centimeter, and if you don't train for next 3 months, then it will be reduced to again 10 centimeter. So that is what these principles mean.